Dr. Shaya, tell us about your experience also from a family office perspective.
The highest level of giving is giving intentionally and forming partnerships. So how do we see that? I'll give you two examples. One is we used to give a lot of money to veterans because that's something near and dear to our hearts. Instead, now we have 103 service-disabled veterans with disabilities that work for us today in a unique partnership in Atlanta, Georgia with Bobby Dodd Institute. The second example is we have a partnership with the Navajo Indians. So we won a contract, a large contract in New Mexico where we're taking care of 70,000 Medicaid patients in New Mexico, one of the sickest populations in the United States. 25% of that population is over the age of 65. And now in this partnership, we're also going to be taking care of 400,000 Navajos in Utah, Arizona, and New Mexico. And not only is it a true partnership where we have a location there, we're going to have hundreds of people. We have 25 people currently today there. But we also set up a school to train people for future skills. So for example, home health. That's a huge problem area. Phlebotomy, certain skill sets, behavioral health, therapists. So when you give people jobs, you give them opportunity. I think when you talk about health equity, let's talk about giving people meaning and purpose.
This question, I love the framing of it because it's kind of called a magic wand, right? We're here to talk about health equity. Stephen, over to you now. Your magic wand, and why does this matter? You know, what we're doing today, how can we take it to the next level?
Well, humanity and health are not political footballs. They should not be politicized, first and foremost. We got to put the human back in humanity. We got to put care back in healthcare. We're all divine beings on a human journey. If you give people health, you give them hope. And you give them hope, you give them everything. And I truly believe we have to start from there. And every person in this world deserves affordable and accessible healthcare, period. Now, we can disagree about how that's delivered, but it has to start from there. And if we don't start from there from a core value, then we'll never get there. Margaret Mead said it best. I always remember this quote, "Never forget that a small group of thoughtful and committed people can change the world." Indeed, it's the only thing that ever has. That's the opportunity we have here today. And I truly believe we can come together and we can go out and make a difference, but we have to care about the people first. It's got to start from there. It's not a political issue. It's not a financial issue. And if you start from there, I believe we can, none of these problems are insurmountable.